Coming up, we'll be on location at Vedic Health Ayurveda in Rockville, Maryland, discussing the benefits of Ayurveda and integrative holistic treatments and how they can effectively treat diabetes, fibromyalgia, arthritis, and many other health problems, and address mental health issues such as depression, anxiety, addiction, and more, and improve your overall health and wellness without prescription medications with one of this region's top Ayurveda and integrative holistic experts, Amita Jain. Welcome, Amita. It's a pleasure having you on our program.
Thank you.
It's your first time on the Top Doctors, Top Experts interviews. We have a lot to talk about. We're going to hear from some of your clients a bit later, but I wanted to begin, if I may, Amita, because you're certainly one of this region's top Ayurveda and integrative holistic health experts. You are helping so many people, not only in this region. There are people coming from other states to come to you to help them with various issues and situations they're dealing with. But I wanted to begin, before we get into more about what Ayurveda is and some of the other modalities that you specialize in, if you could please begin by telling us what exactly do you do for folks out there watching that may not know some of these treatments and how they can benefit from them.
I practice a natural and holistic form of healthcare called Ayurveda. Ayurveda is India's traditional medical system. It's over 5,000 years old, and in fact, it's one of the oldest continuously practiced medical systems in the world. And the basis is that health is measured by harmony and balance in the bodily systems, including mind and spirit.
Yes, and it's been around, you just said, 5,000 plus years?
Yeah, it's still practiced today.
That is a long, long time. It's got to be one of the oldest forms and treatments of helping folks, I would imagine.
Absolutely.
So it's really finding that balance. It helps balance people in a total sense, the whole person, hence the word holistic, right? To find that balance and well-being that we all crave for and want and need in our lives to really realize our full potentials and our happiness through our life's journeys. Mm-hmm. Now, why did you choose to practice Ayurveda and not another holistic therapy, for example? Because you have expertise in Ayurvedic medicine.
Mm-hmm. Mm-hmm. Well, because it works. I've seen it work, and it works very effectively. You see, the whole focus of Ayurveda is on the individual and the belief that every person is unique. So it treats not just the symptoms of the patient, but their unique constitution. So for example, if two people complain of headaches, same type of pain, same location, the treatment protocol could be entirely different for both the patients because it involves their psychological, emotional, and physical makeup. And because the treatment is so centered on the individual and their unique constitution, the success rate is generally very good.
Mm-hmm. That's certainly good to know. And you obviously have a lot of success in healing people through Ayurvedic medicine and the integrative approach that you utilize here with your wellness modalities as well. What kinds of cases do you treat? For folks out there watching, for example, mm-hmm. who would be a good candidate for what you offer?
Mm-hmm. I help with a variety of illnesses. To name a few, diabetes, fibromyalgia, rheumatoid arthritis, all kinds of digestive disorders, IBS, IBD, Crohn's, ulcerative colitis, skin conditions like eczema, acne, hormonal imbalances, autoimmune disorders, anything chronic where a patient has found that Western medicine hasn't been successful for them, that's when they generally find me.
So that's a lot of folks that you can help out there that are watching right now. Mm-hmm. And I also understand Ayurveda is a great modality to help folks with even some of the more additional common type of situations and problems like reducing stress, anxiety, better coping with depression, in other words, mental health issues as well.
Absolutely.
As what you touched on.
Yes, absolutely.
Now, what can a new client expect when they come to you initially for a consultation?
Well, my first consultation, in fact, all my consultations are about an hour long. They include an Ayurvedic physical exam, a review of symptoms, head to toe for the patient, and then a lengthy conversation on the client's lifestyle and daily habits, their diet, their sleeping and exercise routine, their work-life balance, stress levels, even their relationships.
Do you really take everything into consideration to customize a plan for each of your particular clients, right?
Yes, yes.
Now, do you use modalities like, in addition to diet that you just touched on, but like herbs, for example?
Yes, my treatment protocols include specialized diet, herbs and supplements, and lifestyle changes specific to the client's constitution and their condition. But my protocol is different, far different from what one might get from a nutritionist or a naturopath. In fact, no two of my clients have ever received the same treatment protocol, and that's because Ayurveda sees each person as different from each other. So to give you another example, if I have two client cases, both having obesity and high cholesterol, the treatment plans could be entirely different. For one of them, I may encourage them to eat more salads, but for the other, salad might be on their food to avoid list.
Yes, that's an important point. That way they can follow the plan and stick with it, right?
That's right.
That's a big part of it as well. And we're actually going to be hearing from some of your clients a bit later. Now, how do you assess a person's constitution? Because you mentioned the word constitution a few moments ago, or body type for that matter.
Yes, that's during my Ayurvedic physical exam. So I look at the pulse, the tongue, skin, nails, also through observation and questions to the clients about their habits, their likes, their dislikes. That gives me a really good picture of their full body constitution from birth onwards.
Very interesting. Now, I also see that you offer yoga and meditation classes. How does that fit into Ayurveda?
Ayurveda is a holistic therapy. We don't look at a disease or an illness to be just physical in its basis. It's almost all illness is connected to the mind or the spirit in some way. Yoga and meditation has been extremely effective in treating diseases where our thought process, our emotions are a contributing factor to the disease. So Ayurveda looks at yoga as medicine for the mind.
Oh, very interesting indeed. And what has been, would you say, Amita, the most difficult case that you've had to treat thus far of all the many clients that you've helped in this area?
I'm working with a client right now, a person who was diagnosed with ALS 6 months ago. And I can say that the Ayurvedic treatment has been very good so far.
And so you even help folks with ALS, and we're going to be hearing momentarily from one of your clients that even had cancers, not just cancer, but multiple cancers and a whole host of other health and medical issues. Another one who had needed a kidney transplant, was told he can only live a certain limited number of years, and here we are 20 plus years later, and we're going to be hearing from him as well, so I can't wait to get to that segment of our interview. Now, do you work with other health care professionals as well in conjunction, for example?
I believe it's very important to work with other healthcare professionals, and in an ideal world, all practitioners would be collaborating together. Western medicine has done wonders, but there are areas where it's failing, and that's where Eastern medicine can help. If we collaborate and work together, we can give our patients the specific care that's best for them and hope for a healthier and happier society.
Yes, indeed. And a big thing that stands out to me here today thus far is that this is all natural. Everything you offer is all natural. There's no prescription meds needed.
Correct.
In fact, you're helping people get off of prescription meds when they come to you, right?
Yes.
And it's an all natural way to really regenerate, rejuvenate, ourselves, not just our bodies, but our mind as a whole, in a total sense.
That's right. And along the lines of your question, oftentimes the people who come to me are on medications, and I'll work with that. I'll never say, get off this med or get off that med. If anything, I'll say, these are some alternatives. Talk to your physician to see
Yes.
if we can work with them or start weaning you off of some of the meds that you're on.
Absolutely.
So it's always a collaborative effort.
Yes, and there are certainly medications that we need to be on, regardless, that we just can't avoid, and we need those to live lives longer. But at the same time, there are other situations and other folks and medications that maybe we can weed off
Absolutely.
of and go the all-natural route to achieve the same, if not better, results without the side effects, the harmful side effects of medication.
Absolutely, yes.
Now, you mentioned to me earlier off camera that you studied at UVA in Charlottesville, Virginia, for a degree in systems engineering, Amita. So the question I want to ask you is, how did you go from being a systems engineer to the field of holistic medicine and Ayurveda? And not just go into this field many years ago, you're one of the best in these fields.
After I got my engineering degree, I traveled to India and I stayed in a yoga ashram in Bangalore. And that was life-changing for me. So I continued on with my studies. And Ayurveda, being a sister science of yoga, drew me towards natural health and healing. So I studied for many years, and then I began practicing and doing the treatments on myself and helping to heal other people. And I found that it worked incredibly well. The turning point for me was when I was able to help a cancer patient using an Ayurvedic treatment plan. And that's when I realized I had to do this full time.
So it was a big moment in your life, right?
Yeah.
A profound decision at that time and we're talking about two extremes: systems engineering, in the box, technical, and all math and all the other things that it covers, to totally something else in a very natural, holistic, mindfulness sort of manner. You are an expert in Eastern holistic medicine, and that really is an extreme life switch for you.
It was a big switch. In fact, I spent 10 years working for big companies, Ernst & Young and Deloitte, and then I worked for several years on Wall Street. 10 years ago, my father asked me to move back here and join the family business, where my husband and I ran a construction company. And it was a decision for me a few years ago to step out of that business to do this work, to do this nonprofit. So it was a big life change, but I felt it was something I needed to do.
Yes, indeed, in a very successful construction company, I might add. So that really was a huge step for you to take because of the healing abilities and the fact that you went from helping folks in other areas, right, with homes and real estate, before that in the financial industry and others with a systems engineering degree, to really an in the box to helping people utilizing out of the box modalities and really empowering and changing lives for the better.
And people were saying to me, I don't know where to go. I don't know who to talk to know how to change my life. You know, things that we think are common knowledge, people actually don't realize what they need to do to improve their lives.
That's right.
And to make themselves healthier. So when they go to the doctors and they say, hey, the doctor says your blood pressure's high, your cholesterol's high, take these meds, a lot of people want to empower themselves, but they don't know where to go.
Yes, indeed. We're now going to hear from a couple of clients of Vedic Health, Ayurveda, and Amita. Welcome, Bruce. It's a pleasure having you on our program today.
Thank you.
We always appreciate it when folks take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Bruce, by having you please tell us what you were experiencing or suffering from regarding your health that brought you initially here to Amita.
Well, it's I'll try to keep it short because I have kind of a little bit of history. I had cancer about 12 years ago.
Oh, I'm so sorry to hear that.
I had, well, it's a good thing. I think it was 4 kinds of cancer. And they were telling me that I was only going to make it a couple years. And now it's 12 years later, and they can't find any cancers at all.
Congratulations.
Yes, it was definitely something from God.
Yes,
and,
indeed.
Very, very thankful for it. But what brought me here is over the years, they had done some things with my stomach where they had a mesh, and I started to gain weight. And I guess age kind of caught up with me, and I didn't realize that I was getting more and more obese, and it was affecting my blood pressure was going up. My sugar was all the way up to where it was pre-diabetes. My cholesterol was all the way up. My LDL was 200 when it should have been 50. So I was in, but I didn't realize it. This was a shock to me. It basically was a shock of mortality. In other words, mortality came to the picture like, I guess we're not around here forever.
Yes.
So I went to my doctor, naturally, like most people would do, and he wanted to prescribe me all these medicines and told me that I would have to take these for the rest of my life.
For all these various ailments that you
Yes.
were going through, illnesses, whether it be, like you said, weight gain and the side effects that come with that and the other issues. And here you're getting prescriptions suddenly being recommended to you by your physician, and not just for a short-term period of time, as you just mentioned, he's talking about for the rest of your life.
For the rest of my life. And he had, and I, on the way to go get these prescriptions, I never filled them. I called a friend of mine, and that's how I found out about Ayurveda Health and Amita. And I just hit my very end. I thought, am I going to go through my life taking these pills? This is the end. It's downhill from here.
That was a huge moment, right?
Yes.
That hit you. It's like a ton of bricks, because when we're all young and we're growing up, we think we're going to live forever. Nobody's
Absolutely.
even, you still have that exuberance, and you look at life as some limitless journey that we're on. And as you get older, or you experience something like you did, which where your life can be taken away, is when those moments, right? That, hey, wait a minute, this is a temporary gig. It's not forever. And then you really had to do some self-evaluation in your case, because you're looking at medications for the rest of your life.
Absolutely. And then I came to Amita, and she was just so kind. The room, I didn't feel like anyone was judging me. And when she talked to me, her insight was unparalleled to anything I've ever seen. And when I say that, she would go through my blood tests. She knew what was up and what was down. She knew what I need for my diet. She asked me about my sleep, which has nothing to do with your diet. She asked me, so this is a holistic approach towards just getting someone better again.
Without the prescription meds.
Absolutely.
And we all know what ends up happening, unfortunately, in many cases with folks who have to take hard prescription meds for a long period of time.
Absolutely.
A lot of side effects.
Well, now I don't, because the diet that she recommended to me, she gave me a choice. It was very, very subtle. She says, we can take the longer approach and we'll get you better on your diet, or you can do something quickly. And me, I'm either all the way or not at all, so I went vegan. Which I'm not going to lie, it was very difficult, But here was the most interesting thing of all, is Amita, by interviewing me and knowing my diet, how I've eaten over my life, she knew exactly how to approach this. And what she recommended was something that nobody on the planet would have recommended. She said, go ahead and keep eating the breads. Or go ahead and keep eating the rice. Because right now it's going to be hard for you, because now you're taking the meat. You've had that all your life. So she knew how to approach this. It was catered to me.
Yes.
Anyone else might have been a different thing. But
Yeah.
this was catered just for me. So when I would feel like eating meat, I'd eat a piece of bread. I don't really eat much bread anymore now. But I'm over the meat, you know. It helped me. She knew how to help me.
So it really sounds like when you came to her on the way to getting your prescriptions, literally, and then suddenly you heard about her, recommended to you, you came here, you met with her, you explained everything, she did a full evaluation and basically customized a plan, a holistic plan, utilizing Ayurveda and other modalities without the medications. So here you are, nearly a year later, and you look great to me, Bruce.
Well, thank you. I lost 35 pounds. My blood pressure is around 110/60. Yeah, pulse has always been a little bit high, but my cholesterol is back to normal. My sugar level, I'm well within normal. So all these medications that I was told I would have to take for life,
Yeah.
I don't have to take.
To get those, yes.
I felt as though these prescriptions are being peddled a little too easily, you know, and that's how I feel, because these are doctors that have studied the body their entire life. And I came to Amita and she knew more than them. I don't know how that works, you know. I'm just saying that I'm standing here today to tell you that I don't eat meat, I don't eat chicken, I don't even, you know, eggs, cheese, nothing. But I feel like I'm 20 years old.
You feel great again, in
Yes,
other words.
yes.
The cancers are long gone.
They're gone.
You've lost weight. You're healthy.
I don't feel heavy. Like when I get up, like every day I get up, I feel like my arms were heavier, like a fatigue kind of that just never went away.
Yes.
And it's just like it was stripped away. And I feel like a completely new person. My vision, when I look at people, like colors, red, blue, green, they're brighter. My hair is growing like crazy. I don't know, there's a lot of things I can tell you that it doesn't make any sense to me, but I'm here for the ride. I'm a believer.
Yes.
You know, and if anyone else is out there and they need the help, I wholly recommend this approach in this clinic.
Yes, indeed. And I really appreciate you coming in, sharing your experiences about where you were in the past and where you are today. And your health is there. You've got your exuberance. You've got your energy back, Bruce. Mm-hmm. You can tackle life and all that it throws at you again with zest and energy.
Hopefully.
Yes, I can pick it up in your vibes as far as and your exuberance. As I said, I am so happy to hear that. And before we let you go, Bruce, is there anything else you'd like to share with our viewers?
Well, if you're out there and you're just thinking, should I do this or should I not? It only takes a baby step. It's only one little step at a time. You know, just come in and talk to somebody, and it's one little step. It's not like you have to tackle everything at once. And there are people here that can help you. And it's not just, it's a holistic approach. It's not just your diet. It's your spirit, you know, your love, your life, and your diet, and how you sleep, and everything. And you come out of here like a new person, you know, and it's catered to you because everybody's different.
Yes. And it's a natural
Natural
form
approach
of wellness and integrative health and different modalities like Ayurveda and others that you've been, obviously on that plan and to where you are today without prescription medications.
Yeah.
And on that note, we'd like to thank you again, Bruce, for joining us, being a guest in our program. It was our pleasure having you on.
Thank you.
And stay on the right track, the good health track.
Oh, I will.
All right. Welcome, Prem. It's a pleasure having you on with us as well. And I wanted to begin by asking you, Prem, if you could also tell us what health condition were you in and what you were experiencing that initially brought you here to Amita?
In 1996, I found that I have kidney disease, and I was told by my doctors that I have 5 years, max of 5 years. Okay, and usually when you get kidney disease, it's terminal. The disease will take over.
Yes.
There is no reverse. You can't reverse this disease. So I thought that there was no pills or medicine available to prolong the life. So I took help from Ayurvedic knowledge from Amita to help me see how I can proceed to prolong it.
So you decided to go this holistic route through Ayurveda, and you came to see Amita, and what happened?
Okay, when I came to see Amita, so then she told me at that time that, look, there are a few things you have to do. And the main thing was to change your lifestyle, okay? So I used to eat meat, and I loved seafood and all these hamburgers and everything, and beer.
Like many of us.
Yes, and beer and wine and whiskey and everything. So first thing she did was she took me off all this. And she said, if you want to prolong, if I have to prolong my kidney function so that I can last for a longer period of time, I have to give up all these food habits. So she guided me to eat food as a medicine. Treat that when you take food, you will be taking medicine. And you have to control your senses, and you have to give up the love of taste. So it was a tough choice. It was a tough thing to do but I had to make a decision whether I can last longer, use the existing kidneys, or go for dialysis or transplant. Start preparing for it.
It was a huge decision at that time because, as you just said, 23 years ago, you were told you had no more than basically 5 years or so to live and you needed a kidney transplant. It was terminal, and from all that doom and gloom and potential tragedy that was on, within 5 years or so, based on what the doctors told you, you came to Amita. You went the holistic route through Ayurveda and the different modalities, treatments she offers, utilizing an integrative approach. And what happened after you started going onto this plan after some time?
She put me on a strict diet. The diet was very strict because basically she said that I have to avoid proteins because proteins cause the kidneys to work harder. So I have to cut down, even on vegetable diet, I had to cut down foods which were having protein, like kidney beans and all that, lima beans, kidney beans. I couldn't eat those. And she also cut down the high potassium foods for me, like lentils and all that, and potatoes and tomatoes. They were also gone. So I had a very limited choice. Alcohol was gone. I never smoked. And she also put me on a regiment exercise diet. So exercise routine, so which I averaged like at least 25 miles a week.
Oh my goodness.
Brisk walking. And she also told me to lose weight, and I lost about 55, 60 pounds.
Congratulations.
From my original weight. And she prescribed me some techniques and yoga and meditation techniques to keep my blood pressure under control and keep the cholesterol, and kept me away from getting diabetes, which is so common. Yes. And as a result, I am 18 years later, I'm still functioning with the same kidneys.
Incredible, Prem. Incredible.
So at least 18 years have gone by that I have not noticed any problem with me. Of course, the kidney function does keep going down, and it will keep going down once you get the kidney disease. But I have given it extra 20 years.
Yeah, and counting, hopefully many more. Yes, without having the kidney transplant.
Yes, and the live kidney transplant lasts like 14 years, okay? So if after 5 years, in 2001, I would have taken a live kidney transplant, then at 14 years now, I would have had a second transplant now.
Yes.
So right now I have avoided that transplant and led a much better life. Much better. I feel a lot more active. I feel a lot more energetic. I do a lot more work and I sleep better, and all due to the lifestyle changes and basically the diet, the exercise, cutting down the stress, sleep, and just keep working.
So coming to Amita has had a profound life-enhancing and life-changing benefit for you. What a great blessing.
Yes, and I'm happy that in a way that she recognizes that she has to help people, and she left a very lucrative business to serve people at no cost.
Yes, indeed. She's doing so much for this community, helping so many folks like yourself and many others. That's why we're very proud to be here today, to interview her as well as hearing from you and Bruce. And before we let you go, Prem, is there anything else you'd like to say?
Well, I would like to say that we always believe in the regular medicine, but the alternatives are a lot more powerful. And they are not money makers for the pharmacies and for the drug companies and for the medical field, so that's why they are not brought up to the limelight. But if you really have some kind of sickness, and it's definitely worth a try.
Yes, indeed. There are situations where, yes, you have to have surgery or you have to be on medications every day for the rest of our lives, depending on their particular health, medical condition. However, there are alternatives like Ayurveda, like Eastern holistic medicine, integrative health and wellness modalities that obviously Amita has great expertise in, that one should definitely look at, should definitely try as an alternative, because there's nothing to lose. You still would have to go on those medications if it didn't work, but what if it did, like in your case, in Bruce's case, and so many other folks that Amita's helping in this region without the medications, in a very natural and healthy way. So we definitely want to thank you, Prem, for joining us, being a guest as well on our program, and it was our pleasure having you on, and we are so happy to hear about how you are today in great health and great wellness.
Well, I would like to add on to it that there is no medicine which should be used exclusive. They are all work hand in hand, and you find the best way to solve your problem. The good part with Ayurvedic approach is that the side effects are very minimal.
Yes, which is very important.
Because it's all made from natural ingredients. So.
Yes, indeed. Well, on that note, again, thank you, Prem.
Thank you.
It was our pleasure.
Thank you for having me.
Thank you. We're now back with Amita. I must say, both Bruce and Prem, you did such great work there. Look, and these are just two of so many examples of people that you are touching, helping, healing, saving lives in some cases, as we just heard, with Bruce and his cancers, weight gains and everything, all the issues that come with being obese, as he just mentioned, as far as health issues go. And then in Prem's case, kidney transplant was needed 20-some years ago, was told he has no more than 5 years to live. Here he is 23 years later. These are just some amazing examples of the tremendous work that you are doing, Amita. Literally like an angel from God. You are touching lives to help people have their lives and live their lives. Great job. Now, your organization, Vedic Health Ayurveda, is a non-profit, as you just mentioned a moment ago. Why did you decide, Amita, to operate under a non-profit?
My focus, my entire goal is to try and help every person that comes to me in whatever way that I can, to help them make positive changes in their life, to guide them to a better lifestyle, to give them a more optimistic outlook, and to show them that the decisions they make in their everyday lives impact their health. I don't want to be faced with some of the pressures that other businesses have. I want to be able to focus on the client and caring for them. I often spend 4 to 6 hours on every treatment plan that I develop, and my consultations are rarely less than 45 minutes. If I had to worry about operational costs and overhead and turnover, I wouldn't be able to give this amount of time and attention to my clients. I also want to make it affordable. A lot of people out there can't afford to see an alternative medicine practitioner because insurance doesn't cover it. So where are those people supposed to go? Who's going to help them?
Yes. Yes. And that is why you set it up under a nonprofit.
Absolutely.
You're doing such great work for the community. That is really giving back, Amita, to the community and to all the folks that are benefiting from your services and your expertise. So great work indeed. Now, how have people been finding you? Because I know you're become quite popular among a lot of folks as the go-to person to help them with a wide range of issues, which you've touched on, and we heard from a couple of the clients as well, and other areas that you help people as well in. How are people finding out about you more and more?
Actually, it's just been through word of mouth. I don't advertise, so it's really just been people telling friends and family. I do have a website with some information, but that's about all.
And what is that website for the folks watching?
VedicHealth.org.
And Vedic is VEDIC health.org.
You got it.
Okay, wonderful. Now, we're literally out of time, but I just wanted to add something before I let you go, because this is truly a very amazing and wonderful story, Amita, that you have been sharing, how you're helping folks, the couple of the folks we heard from who are clients of yours who changed their lives and extended their lives, as just a couple of many examples. What would you say is your inspiration to keep going, to keep giving back? What drives you? Because what you've done in your life from where you were and doing, in the business world, the real estate world, the financial world, the engineering world, all these last several years in the holistic world, the integrative health, wellness, Ayurvedic world, and touching so many folks in a very powerful manner. What is that inspiration? I have to know.
I think what inspires me most is when a patient first comes to me and it seems that they've lost all hope. They think that they'll never be able to live without their pain, or that they can't heal. And a month later, I see them making incredible changes in their life. They look happier, healthier, and then they come back and say to me, I did it. I didn't think I ever could, but I feel so much better, and I feel great. I did it, and that's what keeps me going.
It's that satisfaction, that happiness, right, of seeing that person's life change for the better in multiple ways and becoming a whole person again.
Yes.
When you include everything. Well, on that note, we'd like to thank you again for joining us, being a guest on our program, Amita. You are doing such tremendous work throughout the region and beyond in helping so many people. And it was a great pleasure having you on our program. And we'd love to, in fact, have you back on in the future.
Thank you. Thank you so much.
Thank you.
Thank you.